So next up, we'll be hearing about the concept of Springboards and what that could mean for healthcare innovation. So I'd like to welcome to the stage two Peters, actually. Peter Uppman, Innovation Strategist at Region Halland and Business Coordinator at Leap for Life, and Peter Astrup, Center Manager for Test and Development for Welfare Tech in Viborg, Denmark. Welcome.
Thank you.
Thank you. Well, thank you for that. Now we're going to get practical, actually.
Yes.
We're going to talk about how we can actually enhance this collaboration between private companies and the healthcare sector in what we call Springboards as a concept. So first of all, I would like to say that we have now launched a new Menti for you. So I hope you can all now go to the Menti again. There's a question for you about the challenges in collaboration between private companies and the healthcare sector. So write your thoughts about the challenges that might be. And we will present what we think are some of the challenges and how we solve them, actually.
Yes.
So I'm Peter Uppman from Leap for Life, and
I'm Peter Astrup from Denmark at the Test and Development Center for Welfare Tech.
And we are actually collaborating in a project called CareWare Nordic, where we try to develop new welfare technologies across the borders between Sweden and Denmark. And that's where we use this concept of Springboards. So the key takeaways during these 20 minutes we have is that we will show how we use the concept of Springboards to screen new ideas, to screen companies and solutions, but also how to create value across the borders, as we said, in this project. But also how we create value and new insights to the companies during the development phase, so they can go back and adjust their product development. But we do also create value for the people in the Springboard, the healthcare professionals and the patients that we bring onto a Springboard. And we will show that as well. So I don't know if you have had time already to answer, but can we bring up the Menti and see if you have some ideas on what are the challenges? Is the Menti already loaded? Some. Public sector moves much slower. Different tempos. Yeah.
Find common ground to communicate and collaborate. Yeah.
Yeah. Good. That was at least two.
That's two. That's more than one. Yeah.
That's more than one. So maybe we should go back to the slide. We can come back to this later if we have time, but we go back and Peter, what do you say are the needs?
Well, if you look at the needs, we've been spending a couple of years actually working with companies and trying to create a collaboration between companies and health and social care sector. Instead of going through this diagram, I'll tell you a short story of a company that we've been working with that kind of sums it up here. If you look at it's a company that works with developing a new solution to identify pressure ulcers at an early stage. And what we noticed when starting to work with this company is that both health and social care sector and the private companies are quite risk averse. The public sector, health and social care, is quite risk averse because, we have a new company here. They draw data, they use the data. Who should actually act on on that data? What responsibility will it impose on us? Basically, you could say that mistakes in the public sector and the whole healthcare sector is lethal. On the other hand, you have the private company. They're quite risk averse because mistakes are expensive. Basically, when they start to work with the healthcare sector, the healthcare sector will try and say, all right, well, we could use this, and this could be interesting. And what about this idea? So they're quite risk averse in the fact that how long down the rabbit hole should we go before actually launching a finished product? Because again, mistakes are expensive. When you look at the health and social care sector, again, their time horizon is actually very long. They don't have a big need for change necessarily, and they have very, very long decision. It takes a long time to have to make a decision. They have quite a lot of bureaucracy. On the other hand, you have the companies, short time horizon, because, well, they need return on investment quite quickly. Returning to the healthcare sector, they have a lot of systems thinking. Again, with the company dealing with pressure ulcers, if this product might be good and it might prove very effective, but if it doesn't fit into the organization, into the workflows, and into the overall data management system of the region or the municipality, the effect of this solution might be close to, well, zero. On the other hand, of course, you have the company, very creative. You know, they've already from the start they've been thinking, oh, we could use this solution not only to track pressure ulcers, but actually also to look at sleeping patterns, weight changes over time. So you can start to look at the development of diabetes. So you have these two parts looking at each other, one moving very fast and one moving very slow. One thinking systems and one thinking opportunities. Which brings me to the last point, because you also have a public system, at least in Denmark, public system, where they're quite, well, pessimistic might be the wrong word, but the idea here is that they have, of course, limited economy and limited resources, especially for testing and developing and implementing new technologies. Whereas you have a private company, very optimistic, and basically they're like, well, we can solve any problem in the world. Thank you, Peter. Well, this creates, of course, complexity in the collaboration. Basically, what we thought is that, well, there is a need to actually bridge the gap between the public sector and the private companies to create earlier user involvement in the design and development of the new products and services. What we found out is that no, there isn't one solution. What there is a lot of hard work. And we've tried to develop a framework that can be useful in the engagement between the private companies and the healthcare sector.
So we call this concept the Springboard. So what is that? Well, we're going to use a lot of cases today to show how this actually works and how it brings value. And let me take another case then to describe what a Springboard is. We had a Danish company developing a glucose meter for diabetic patients. They came to us and wanted to know more about the Swedish market. So we brought in a couple of diabetic nurses to the room, 3 diabetic patients, and some developers. So what we do in a Springboard is we gather these people in a room. The company gets to pitch their idea for 10 minutes or so. And then we have a discussion during 2 hours where they can actually get feedback from the actual end users to how could this actually bring value to their daily life and their daily routines, and how could this be integrated in the systems they are using, and what would actually be valuable to these end users. So we actually do this user-led innovation and bring both patients and users as nurses or doctors or whoever is the end user of a product into the same room, and we get feedback from them. This might sound easy, but you can describe more about the process, Peter.
Yes, because of course it's not just spending 1 or 2 hours in a room with a couple of nurses or somebody from the patients or whatever. Actually, the process is, of course, somewhat longer. We spent quite a lot of time in what we call the pre-analysis phase. The pre-analysis phase is often between 2 and 6 weeks. We get in a dialogue with the company, trying to find out, all right, what are the actual challenges that you face? And on the basis of that, we try to find out what will be the right persons to gather around the table. Let me see. What we also once in a while do is that we actually bring in the company for an early presentation. You could call that a pre-springboard or whatever, but the idea is actually to have a very quick validation to see, is the idea of this company actually interesting enough for the healthcare sector to actually engage with. We had a case just a couple of weeks ago that we did a pre-springboard with a company actually working within VR, and we had a couple of people from the municipality and the hospital, and the basic response from this pre-springboard was, well, interesting idea, but you need to go back home and do your homework. Please, we would like to talk more with you, but at a later point. If, of course, the idea or the solution is interesting enough, we do the springboard, a 1-2 hour session where we look at, where we dive into how can this solution work in the daily use, on, well, bedside, really. How will this solution work within the system? How can it be integrated into the system? How can we do the data flows, workflows? And last but not least, we actually ask, what is the value of this solution? Because one thing is that you can do all the other stuff, but the next question is, well, what do we do already? And is the stuff that we do already more effective than this new, amazing technological solution? Well, sometimes it actually is. If the springboard is well received and the company is well received, then we can delve into the next phase where we could start a real life test or working on developing different solutions. That is the next phase. Yeah.
So let's go into some of the cases, and this is your case, Peter, from Denmark.
This is a case that a company that we've been working with for some time. They're called DigiRehab. It's a Danish company that actually makes a digital solution for home cares, for training elderly people in their own homes. Normally, you will train elderly people. It'll be a physiotherapist or an occupational therapist going to the elderly person's home and doing the training. DigiRehab has developed a solution whereby normal care workers can train with the elderly people over a 12-week period of time, and they have a system where they can see what kind of exercises should be made. They can track progress, and they can actually document that this has an effect. What DigiRehab wanted was actually to find out, well, we're quite successful in Denmark. We're in like 30 Danish municipalities, but how does the Swedish market look? Can we penetrate the market? So the springboard that we made, we brought the Danish company to Halmstad and did a springboard with some core people to find out, well, how does the Swedish healthcare system work? Who's responsible for what? Who benefits? Who pays? And how is the healthcare system organized? But instead of me telling you how well this springboard worked, let's hear what the CEO, Niels Høyer, says.
DigiRehab has participated in a springboard in Halmstad with participants from different municipalities around the Halmstad area. It has been a great experience. We got some really great insights from our springboard. First of all, we assumed that the Swedish model for home care services was more different from the Danish model than it really is. The overall conclusion from the springboard is that the DigiRehab solution ought to have a good market fit for the Swedish home care market. The setup around the springboard in Halmstad was a perfect way to get potential customers to openly discuss their hypothetical use of a new product without being in a normal customer versus vendor meeting. Over the last months, we have been evaluating the welfare models in different European markets in relation to our DigiRehab solution. We're now planning how and when to start up in different markets, and with the insights from the springboard, Sweden will definitely be on the list for countries relevant for DigiRehab.
Could you feel him saying congratulations to us?
Yeah. Thank you for that. It's a good case. The next case is a Swedish company. It's a VR company called Mimers. They develop a virtual reality treatment focused on mental illness in different various, so different phobias and ways to counter your phobias or disorders with VR technology. And they came to us and they wanted to know, is there actually a need for this, for these VR solutions that they are developing? And what would be the challenges in implementing this within psychiatry in Sweden? So we put up a Springboard here in Halmstad as well. And we focused on the needs, and we brought in psychologists and developers and caretakers within the Springboard. And let's hear what the CEO of Mimers, Niklas Wikström, says about this Springboard.
When we were in Halland, spoke to mostly psychologists and nurses, showed our VR products for decreasing stress and anxiety and fear of public speaking. They got to test everything. We got to tell our story behind it and all the research, and they were quite impressed with what we did, which is also positive, that you get some motivation to continue. But then also that we got ample of time to tell our story and that people can actually try the products, because usually when we show people our products, they've never tried virtual reality before, so it's almost impossible to explain in words or through video, for example, that you have to experience it. So it's a very good opportunity to get these people to actually try your products. And then you get a lot of positive feedback, which means that you get motivation to keep on going, and sometimes give them ideas as well, because we have some psychologists in our teams, but it's useful to hear psychologists from different areas and see how they kind of approach a specific mental health disorder, and that gives us ample feedback to go back to our developers and add features and so forth. So that's a very, very positive thing.
Yes, and we should say that this Springboard was pre-corona, where we could actually gather people in the same room. They could try the VR headset and try the solutions they have developed. Since the last 6 months, we are doing all the Springboards digitally, so we don't really get this interaction with the product itself. But it works.
Yeah, and I would just like to mention that actually we in Denmark are now working with Mimers with the birth ward and the fertility ward in Viborg to see how their solution can work in managing pain.
So this actually also creates value across the borders. Yeah, and which is also easier now when we do digital Springboards. It's easier to get someone from Denmark to participate in a Springboard in Sweden and vice versa, of course. So the last case, we only have 2 minutes left, I see, so we have to hurry up. The last case, it's another Swedish company called Visible Care. They develop what they call nanopedagogics to train healthcare professionals with on-the-go video trainings. And I wanted to know, is there a need for this, and could this actually be used in the daily life of the caretakers? So we put up a Springboard again in Halmstad with elderly care developers, care centers, to get feedback on the usability of this and the need for this. And this actually resulted in that 2 of the municipalities from Halland who participated in the board, they actually contracted Visible Care directly after the Springboard. So that's a real good market validation for the company. And now we want to hear what the professionals being part of the Springboard says, because as we said before, it actually brings value to them as well to be part of a Springboard. So let's hear what Nina from the municipality of Kungsbacka has to say about being member of a Springboard.
For me, it means that I get the first-hand insight in new products or services that are being developed, and that can absolutely contribute to my work. But it's also an opportunity to give feedback to the developers as well, to help them in a way so they can make the products or services better if needed. So it's kind of a win-win situation. It's also interesting and important to meet other professionals in the board and to learn from their experience. For example, it can be someone in another municipality that has the same job as I do, but they have different methods or tools they are using.
Yes, so that was actually our 20 minutes, I can see. But I think, and I hope we have shown you today that the concept of Springboards does create value across borders, as we said, and as Nils said, and also the Mimers case, and also that it does create value and new insights to the companies taking part of a Springboard. And also, as Nina says, it creates value to the professionals being part of a Springboard. So that was all from us. Thank you. And if you would like your company, if you want us to arrange a Springboard for your company, for your new product or services, or if you would like to participate as a healthcare professional in a Springboard, please contact Peter Astrup in Denmark and Peter Uppman in Sweden. Thank you.
Peter and Peter.
Thank you so much. And you will join the discussion panel later, so
yes.
See you soon.
Yes.
Yes.